Hello and welcome back to my blog. My name is Sabine. I'm a nutritionist and health coach, and I specialize in fatigue and stress management. Today's video is about the thyroid. And are you experiencing symptoms such as depression, brain fog, weight gain, difficulty losing weight, constipation, fatigue, anxiety, difficulty sleeping, dry skin, hair loss, brittle nails, loss of libido, feeling cold a lot of the time, a hoarse voice, irregular menstruation, infertility, muscle stiffness and pain? Well, your body could be telling you that your thyroid is not functioning the way it should. The reason for this blog is to spread the word to as many people as possible, to have your thyroid hormones tested, to rule out hypothyroidism, in case you are experiencing any of the symptoms I've just mentioned. And you might say, I've already been tested and it came back normal. Aha! A lot of the times, however, you will only get two things tested: your TSH, the thyroid stimulating hormone, and the T4, the inactive thyroid hormone, which doesn't really give you the full picture, and you might still be left with your symptoms. The reference range for TSH is also relatively high, so your levels might be classified as normal when they're really not optimal at all. So if you have been tested and you still have symptoms of hypothyroid, as I've mentioned at the beginning, please get yourself tested properly, and I will get to that in a moment. If you leave it, it could lead to further issues down the line. I know of a few people who were prescribed antidepressants, for example, without their GP checking their thyroid hormones. Symptoms of hypothyroidism and depression are very similar. You are in charge of your own health. Ask your GP for a thyroid test that includes all of the following: TSH, free T3, your active thyroid hormone, free T4, and also tests for thyroid antibodies, which is called TPO. One of them is called TPO. If your GP is too busy at the moment, you can also have your levels checked by using a private test, and there are finger prick tests available as well, which you can do at home, and then you just send the sample off to the laboratory. You can book a free 30-minute chat with me if you are unsure. I can get to know you and your symptoms a bit more, and I can let you know how I can be of help. The thyroid test that I use has all the markers included that I mentioned earlier at an affordable price. And it also tests for iron, vitamin D, B12, folate, and it includes an inflammatory marker as well. Every cell in your body needs thyroid hormones to make the energy it needs. You can think of thyroid as the central gear in an engine. Without it, the engine can't work. Without it, your body can't convert the nutrients you eat into energy. It is located either side of the windpipe at the front of your neck, and it's sort of a butterfly shaped. 1 in 20 people are thought to be affected by a thyroid disorder, and women tend to be more affected than men. If you are female, over 40, have some of the symptoms that I've mentioned, and a family history of thyroid conditions, have yourself tested and get in touch. I'm looking forward to speaking with you. Until then, take good care of yourselves. Bye-bye.